Hello and welcome to the Bearded Dentist. Today we will be doing another anterior crown prep. So as you can see here, this is a lateral incisor in between a canine and a central incisor there. This tooth has seen better days. It's got two very large fillings that wrap around to the back or palatal side of that tooth. Both of those fillings are failing. They have leakage and cavities underneath them. You may be wondering, why are we not doing the adjacent teeth? Why are we just doing the single teeth? Obviously, the adjacent teeth need some work as well. Um, and that is because all of the teeth in the front, pretty much this woman needs some sort of restoration or crown on almost every single tooth. She has a very large, extensive treatment plan that is very expensive. So what we do in cases like this is we pick the worst tooth, or WTF, worst tooth first. And what we're trying to do is avoid tooth loss and root canals. Now, I don't have anything against root canals. They're great when they're needed, but if we can avoid them at all costs, we like to. So when I look at a patient's treatment plan and they need 10 crowns, and I see one or two of those teeth really can't go any more than a couple more months before they're probably going to need a root canal or get very close to needing a root canal, then we really try and knock those out first. Even if it's just going to be, one nice tooth amongst a bunch of, other broken down or decayed teeth, so be it. This patient is fine with just having, one fixed tooth in the middle of others that are stained and decayed and cavitated and stuff, because what we're trying to do is avoid root canals, because when a tooth has a root canal, its overall prognosis diminishes greatly. And root canals are expensive, and they're not the most fun thing, and patients don't want to do them. I don't like doing them. Um, so, you know, what we do is we just educate the patient and tell them, hey, best thing we can do is knock out these couple, and then when you can afford to or have the time to do the other treatment, we'll get to it. I tell folks, it's like driving a car. I'll steer, but you control the gas. So luckily, though, as you can see, after we've removed the cavity, which I'm just removing the final little bit here on the palatal side, um, we still have a lot of tooth structure left. We're nowhere near the root or the nerve, sorry. And when I say nowhere near, I mean we're probably like a millimeter away from it in any given direction. But a millimeter to a dentist, that's a mile. So we're plenty far away. Now, I never tell patients we're ever out of the woods, because just the drilling, the friction, the trauma we put on the tooth, the chemicals, everything, all of that can cause a nerve to trip or need to, go to the point where it's irreversible pulpitis, we call it. Tripping a nerve is like flushing a toilet. You can either flush a toilet or not flush a toilet. There is no in between. Once a nerve of a tooth is tripped or has gone irreversible and inflamed, then that's it. The only thing that will stop that pain is when the tooth dies or you get a root canal. Now, if the tooth dies, then it's going to go necrotic. Then you're going to get an abscess. You'll need a root canal anyways. So, waiting for it to die still isn't an option. Um, but yeah, so what I'm putting on here is iron sulfate. It is a kind of like a cautery agent. It basically stops the bleeding. It's called Quickstat. A lot of dentists don't like using this in the front teeth because they say it stains the teeth underneath the crown later, and you get like those black iron stains from iron oxidizing bacteria. But I found that I scrub my teeth with tubeless and bleach after, which is what I'm doing here after I use that stuff, and I never have issues with that. And it's great. It's very cheap and it's very quick and effective um, at getting the gums to calm down, as I say to patients. So here we're doing the final scrub there, and I do scrub on the adjacent teeth a little bit, and we're going to get ready to put the buildup in. So here we have the etch. This is the phosphoric etch. Now, I don't etch for very long because I don't selective etch, meaning I put the etch all over the whole tooth. I don't just do it on the enamel. I do it on the dentin as well. So I don't etch for, 20 seconds because also my bond has etch in it as well. And if I etch for 20 seconds on dentin and then put bond on there that also has etch, I'm going to over etch the tooth, which can lead to maybe needing a root canal. And it can also cause a lot of sensitivity and even create a worse bond because the tooth is so over etched that we don't get a good bond to it. So as you saw there, after I etched and rinsed, the lip touched the tooth, so we did have to, I don't do a full re-etch, I just spray the heck out of it and scrub it with bleach before I go ahead and put the bond on there. Like to air dry that bond, smother it all over the place, air dry it. I used to be very cautious and worried about getting bond and build up on the adjacent teeth because I didn't want to have to prep it off. Um, but that it is so time consuming to try and put a band around the tooth and try and wedge it and keep the bleeding down and all that. It's just so much faster just to prep it off the adjacent teeth. I mean, most of the time it doesn't even stick. It flakes right off, and even if it does stick, you just polish it off with a burr and it's no big deal. So I just ice cream cone it. I mean, it's so much easier and faster just to know that you're going to prep it off anyways, um, and not even bother. And here we're just going to, find a beautiful prep underneath that buildup and the rest of that tooth. Um, I'm not going to show the final prep here. Not going to show the whole thing, mainly because, I have to use multiple assistants for this when we're using this camera. I have finally gone on Reddit and just asked other dentists, what they use, and I think I might have landed on a loop cam. It's about $1,000 cheaper than the current camera I've been looking at, and I was able to actually see videos from other, real dentists that don't work for loop cam or aren't sponsored by them, and they were able to show me some footage that they took themselves, and it was really impressive. And it'll be nice because you won't get the shakiness that you're seeing here. I'll be able to show a full point of view what I'm seeing, um, which is a lot better most of the time than what you're seeing here, which is, the assistant holding it. There's going to be no water droplets on the camera. So for those of you that have subscribed and kind of stuck with and dealt with these shaky videos, I really do appreciate it. Like I said, we are going to get a new camera, and I know I've been saying that for a while, but I mean, when we're talking $3,500 for a camera, that's a tall order. So I really want to make sure I get the right thing, and so I can provide the best quality videos for you guys if you just like watching this stuff, or if you like the information. Um, I really do like making these. Hey, thanks for all the likes, subscriptions, comments. If you hate it, love it. I appreciate every comment, no matter what. So thank you again. And that's the Bearded Dentist. I will see you on the next one.